Welcome to the Explainer. You know, when something feels off in our lungs, it can feel like a total mystery. So today, we're going to pull back the curtain on the incredible medical toolkit doctors use to follow the clues and crack the case of what's really happening inside our chests.
It's a huge question, right? When you've got that cough that just won't quit, or you feel like you can't quite catch your breath, how do doctors get from those symptoms to an actual diagnosis? Well, it turns out it's a process that unfolds just like a fascinating medical detective story.
Every single investigation has to start somewhere. And before any of the high-tech scanners are even plugged in, doctors have to lay some really essential groundwork.
Now, this might actually surprise you, but for a whole lot of patients, the mystery gets solved right here. I mean, before any advanced tests are even on the table, a doctor simply listening to your story, doing a physical exam, and running some basic blood work, that often reveals the answer. A lot of the time, the high-tech tools we're about to talk about are just used to confirm what they already suspect. Okay, but what about when those first clues just aren't enough? Well, then it's time to look inside. So now we turn to the imaging toolkit. These are the powerful instruments that give doctors a view into the chest without ever making a single cut.
The real workhorse of respiratory medicine is the good old chest X-ray. It's almost always the very first picture they take, and it gives a fantastic, broad overview of all the major players in there. You've got the lungs, the heart, that central chest cavity, and even the bones and blood vessels around them.
An X-ray is really all about reading light and shadows. So when a doctor sees increased shadowing on the lungs, that's not some smudge on the film. It's a critical clue. It could mean there's fluid building up, that a part of the lung has collapsed, or that an area is packed with inflammation, a condition they call consolidation.
And these clues can get incredibly specific, something called a mediastinal shift, where the heart and other structures are literally getting pushed to one side. That's a huge red flag for a collapsed lung. Or seeing an air bronchogram, where you can suddenly see the little airways inside a shadow. That's a classic sign of pneumonia. It's truly like a secret language that doctors learn to read.
So, if a chest X-ray is like a flat, 2D photograph of your chest, a CT scan is like a super detailed 3D map. It doesn't just take one picture. It takes hundreds of little cross-sectional slices, and then a computer stacks them all together, letting doctors see the chest's anatomy in absolutely incredible detail.
And having that level of detail makes the CT scan a real game changer. It's absolutely crucial for figuring out the stage of a cancer, for perfectly guiding a needle to get a biopsy, for spotting life-threatening blood clots in the lungs, and for keeping an eye on how a disease is changing over time.
All right, imaging gives us the map, but sometimes a detective has to actually go inside the building. This is where scopes come in. They let doctors get a direct look deep inside the body's airways.
The key tool here is the bronchoscope. It's this thin, flexible tube with a tiny camera on the end. And while the patient is comfortably sedated, a doctor can navigate this scope all the way down through that branching network of airways in the lungs, seeing everything in real time on a TV screen. It's pretty amazing. But here's the wild part. The bronchoscope isn't just for looking. It has these little channels inside that let doctors do all sorts of incredible things. They can use tiny brushes to grab some cells. They can take small tissue samples called biopsies. They can even pull out something you accidentally inhaled. They can use lasers to treat tumors or even place tiny scaffolds called stents to prop an airway open. It's both a diagnostic and a therapeutic tool, all in one.
So, we've taken pictures and we've collected samples. Now the investigation moves to the lab. This is where some of the most important clues are found, and they're completely invisible to the naked eye.
The stuff they collect can reveal a whole hidden world of information. Lab tests can pinpoint the exact bacteria or virus that's causing an infection. They can find things like elevated IgE levels in the blood. That's a classic fingerprint for asthma. Or special autoantibodies that point to an autoimmune disease. And of course, this is how they identify malignant cells from a biopsy.
And these microscopic clues come from all over. They can come from simple things like sputum or a blood draw, all the way to fluid that's been collected from around the lungs, or those tissue biopsies we just talked about from a bronchoscopy. Each sample gives them another unique piece of the puzzle.
Okay, so we've looked at the lung structure. Now it's time to test its function. You can think of this next part like a performance evaluation. Just how well are the lungs actually doing their job?
The most common performance test is called spirometry. The whole idea is pretty simple, actually. You take the biggest, deepest breath you possibly can, and then you blow it all out, as hard and as fast as you can, into a machine. What it's measuring is the total amount of air you blew out and how much of that air came out in the very first second. And the relationship between those two numbers, that's the key.
And this is the magic number. If you can't force out at least 70% of your total lung volume in that very first second, that is the defining sign of an airflow obstruction. It's a hallmark of conditions like asthma or COPD, where air is getting trapped in the lungs. It's such a simple percentage, but it tells a really powerful story.
The other main job of the lungs, of course, is gas exchange. The absolute gold standard for measuring this is an arterial blood gas test. It's a blood drop, but from an artery, and it gives super precise oxygen, carbon dioxide, and pH levels. But for a quick, ongoing check, that's where the pulse oximeter comes in. You know that little clip they put on your finger? It's a fantastic, totally non-invasive way to track your oxygen level.
So, we've gathered clues from the patient's story, from images, from scopes, from the lab, and from performance tests. Now comes the final, crucial step in the investigation, putting all of those pieces together.
And honestly, this is the most important thing to take away from all this. A diagnosis is almost never made from one single test. It's about putting all the evidence together, seeing a shadow on an X-ray, exploring it with a CT scan, taking a sample with a scope, and then letting the lab identify the culprit. Each tool just adds another layer of certainty until the full picture is revealed.
Ultimately, the whole point of this incredible toolkit comes down to three main goals. First, to confirm what the diagnosis is. Second, to monitor the disease and see how well treatment is working over time. And third, to measure exactly how it's affecting a person's life and ability to function.
And that kind of leaves us with a final thought. I mean, from the very first X-rays to the advanced genetic analysis they can do on biopsies today, these tools are just constantly getting better and more powerful. It really makes you wonder, as our instruments become even more precise, what respiratory mysteries, the ones we once thought were unsolvable, will we crack next?